With any exercise routine, it's a good idea to warm up by doing at least 10 minutes of cardiovascular activity before performing other types of exercise. A warm-up is necessary to get blood flowing to your heart and muscles to prepare your body for a workout. If you have seen the Introduction to Osteoarthritis and Exercise video on the Arthritis Society's website, you'll recall that there are 4 main types of exercise. Cardiovascular exercise, also known as endurance or aerobic activity or exercise, works your heart and lungs, increasing your breathing and heart rate. For strength exercises, the goal is to make your muscles stronger, to help stabilize your joint and improve your mobility. Neuromuscular exercises involve focusing attention on proper lower extremity alignment position and joint control, reducing the load on your joints and allowing you to move with greater ease. This is also important to help with balance, reducing your risk of falls. Finally, flexibility exercises increase your joint mobility and stretch your muscles, helping you stay supple and limber. After you've warmed up, when you're starting any strength or neuromuscular exercises, it's important to focus on good alignment to reduce the load on the joints and surrounding soft tissues. With any knee bending and straightening activities, make sure your knee stays in line with the second toe of your foot. Don't let your knee collapse inwards. Be aware of proper knee alignment during all activities, even when biking and in your everyday activities such as going up and down stairs or getting in and out of a chair. Watch that your pelvis or hips remain level and your trunk does not lean to one side or forward when exercising in standing position or while walking. With any activity or exercise, you will want to keep your lower back in a neutral posture, the strongest position that minimizes joint load. Neutral posture is keeping the normal arch of your low back without flattening it, tilting your pelvis, or exaggerating the arch. To further support your spine during the activity, tighten your core muscles, the muscles around your trunk, which include your abdomen, low back, and buttocks. This will support your spine so that there is no back movement while moving your legs. To practice this, think about what you would do to prepare yourself for someone about to poke you in the stomach. You would immediately tense and stiffen your core muscles to brace for this impact. This is exactly what bracing is and what we mean by tightening your core in the exercises that follow. From our introduction video, you'll remember the FIT principles: frequency, intensity, time, and type. For strength and neuromuscular exercises, aim for a frequency of 3 times per week on alternate days and make sure to use proper alignment in your everyday activities. Once you've achieved your goal muscle strength, you can reduce strengthening exercises to 2 days per week to maintain your gains. The intensity and time of your exercise will change as you get stronger. To achieve further benefits, you will need to progress your activity once it starts to become easy. Start with 6 to 8 repetitions of each exercise. This is called one set. If you do more than one set of each exercise, it's generally easier and takes less time to perform one set of every exercise first, also known as a circuit, before doing a second set or a second circuit. You may start your program with 1 or 2 sets or circuits of exercise if your muscles are weak, and after a few weeks, try for 3 sets. Once you're doing 2 or 3 sets, you can increase the number of repetitions. An example of a gradual progression could be to add 1 repetition to each set each following week so that your body has a chance to adapt. Your body needs time to adapt, but if you don't gradually increase the load, you will not continue to improve. To increase intensity or the load, there are various ways you can increase the level of difficulty of an exercise. Each exercise we explain in this video has an increasing level of difficulty offered. You can also increase difficulty by changing your body position, for example, starting the exercise on 2 legs, then going to 1, or by increasing the resistance of an exercise band. Once you can do 3 sets of 15 repetitions, it's time to make the exercise more difficult to achieve further gains in strength. When you move up to a higher level of difficulty, start once again at 3 sets of 6 to 8 repetitions. Gradually increase the load by adding 1 repetition to each set every week until you reach 3 sets of 15 repetitions. If you have limited time for a workout, make sure to target the muscle groups you know are weak. For most people, this includes the hip abductors, hip extensors, and quadriceps. If you have hip osteoarthritis, consider adding hip flexor strengthening in addition to hip abductor, hip extensor, and quadriceps strengthening exercises. If you have knee osteoarthritis, consider adding hamstring and calf muscle strengthening to hip abductor, hip extensor, and quadriceps strength exercises. For low back pain, you would benefit by adding front, side, and back trunk strengthening exercises. Each of the exercises we discuss has 2 or more levels of progression. Once you can do 3 sets of 15 repetitions, you're ready to move on to the next level. You may progress faster with some muscle groups than others. It's okay to be at different levels of difficulty for different muscle groups. It's important to include neuromuscular exercises that focus on your trunk and leg alignment. As you may remember from our introduction to osteoarthritis and exercise video, neuromuscular exercise or activity focuses on attention to and awareness of body position and how you move, improving your quality of joint movement, reducing the load on your joints, and allowing you to move with more ease. We've included some neuromuscular exercises in this series to give you an opportunity to practice.